If you still can't afford it, you're eligible for tax credits, which are refundable if you don't pay the income tax. You cannot pay more than a certain percentage of your income for health care. We will cover that. And everybody will be covered. But you have to get covered. And if you don't, first time you come in contact with the health system, you will be enrolled. Because otherwise, it's not fair. It's not fair. Because the first time you get in a car wreck or something, show up in the emergency room, all your cuffs have to be eaten by somebody else, and you get into all the paperwork problems, all the cost problems, everything else. We've all got to take this on as a solemn citizen responsibility. Now, we're going to pay for it by allowing the tax cuts of the wealthiest 1% of Americans to expire. Not because Americans present wealth. It's a good thing that we have millionaires and billionaires here creating opportunities. But because what's wrong is, for those of us who have benefited most from this decade, not to pay our fair share. And we are now, and every person in that income group knows it. It's just a question of paying your fair share. And the second thing we're going to do is save a bunch of money by improving health care. And I will give you only one example, but there are many. If all of us had electronic medical records with privacy protections, it would save you $80 billion a year. And everybody of a certain age will immediately know why, if you think about it. How many times have you been to a new doctor, and before the doctor can give you an aspirin, you have to sit there and answer the same questions about your medical history you have been answering since you were 12 years old. Every time you do it, you run up the cost of the health system. And what's really bad, I can tell the young people in this audience, there will come a time when you do not remember the answers to those questions. Am I right about that? But you still got to answer them and you can't get an answer, much less scared. And then because the doctor can never be sure you're getting the right answer, they do a bunch of tests on you anyway they wouldn't have to do if they had the records. And that costs millions more. And in spite of that, they still make mistakes that they wouldn't make if they had the records, and fixing them costs millions more. So we will get better health care at lower costs. And just those two things are enough to cover everybody. The third thing we got to do is promote wellness. We have to have incentives for employers, for example, that cover health care, to cover the co-pays and deductibles for all the preventive and primary services. All the big employers that have done that for their employees that didn't smoke and quit smoking have made money within 3 years. That is, their health costs have dropped. And most of them within the first year. Why? Because we stayed well. We have got to do a better job of promoting wellness. That's why I spend so much time fighting childhood obesity and childhood diabetes. We cannot be a sick nation. We have to be a well nation that has health care when we need it. First class